So I just want to introduce you to Ellie, who's really involved in Christian medical fellowship at the student level. Ellie was also in Sheffield, which is my hometown, last year for her intercalated degree, and she's going to share about her experiences um, in Eswatini. I had to look it up. It used to be known as Swaziland. So Ellie, I'm just going to make you a
Mhm.
co-host here so that you can share your presentation. Welcome to everyone else who's just joined us.
Okay, just getting set up there. Yeah, so my name's Ellie. I'm currently a final year medical student in Newcastle, and I went on my elective like last June. So we're talking, yeah, so like June 2022. Um, and so I thought I'd just tell you a bit about my experience and some of my tips when you're planning your electives. And so if you do have any questions throughout, do make a note of it in the Slido, and I'll take some questions at the end, maybe more specific to like my elective. But from day one of medical school, I was super keen on my elective and started planning, I think about 18 months in advance, looking at the different options that were there. Working out for me what my key criteria was with what I wanted to get from my elective. So for me, I knew I wanted to go to a Christian hospital to get exposure to something a bit different to what we have in the UK with the NHS. I am not terribly gifted at languages, so I wanted the main language to be English so that I would be able to learn more and not rely on a translator the entire time. I wanted to go somewhere I hadn't been before. I wanted a bit of an adventure, and I really enjoyed traveling. And kind of with the same thing of seeing something very different to the NHS, I wanted to go to like a less developed country, a country that has healthcare, like more healthcare challenges, and somewhere rural as well. And so with that kind of list, I had a different list to what most of my friends had with regards to what they wanted from their elective. So I actually sought out a place by myself, and I didn't travel with anyone or embark on the elective with anyone. Um, so that was a bit different to what other people did. But I also made sure that in my planning stage, I was looking at the fundraising options that were available. Through my university, I was able to apply for some bursaries, which help cover some of the costs. And I know that I was eligible for like touring funding. Some people are eligible to get NHS funding. If you're in your final, like if you're on an NHS bursary, then that can help. So it's definitely worth in your planning stage looking at the funding options anyway as well. But yeah, with this list, my elective planning took me to the Good Shepherd Hospital, which is in Eswatini, formerly known as Swaziland. So it's in Southern Africa, and it's bordered by Mozambique and South Africa, and it's just a really small country, to be honest, and a lot of it is uh, rural locations, people quite far from hospitals. Um, and so in June, I embarked on my elective to the Good Shepherd Hospital in Eswatini. Although I went by myself, I knew that the hospital took other elective students at the same time. And for me, it was really important to know that I wouldn't be there entirely by myself. And so I knew that there would be others there when I was there, and it was great because I got to make some new friends and meet some other girls from a different university to me, and we shared a lot of our elective experiences together. Um, I spent 4 weeks at the Good Shepherd Hospital. Um, our elective is a 10-week block, but it's split 4 weeks, then a 2 week resit, and then 4 weeks again. So um, just based on how I'd done in my exams, it made sense for me not to be away in case I did have to resit. Thankfully, I didn't, but it meant my first 4 weeks was just at a hospital in Newcastle. I'm obviously talking about the second 4 weeks, which was overseas. Oh. So whilst I was at the hospital, there were a few main things that like a few main areas where I wanted to gain exposure and experience. I wasn't particularly keen on staying in one setting. I wanted to use it more as an opportunity to see how medicine was done overseas rather than learning and getting deeper into a specific speciality. Um, some people want to know they want to do surgery and know they want to be in the theatre the entire time. For me, that definitely wasn't the case. So I spent a fair bit of time in their outpatient department, which basically sees a whole range of different things. Some are more emergency acute presentations. Some people are coming in because they need a check of their blood pressure medications. It was really varied. Um, I had some exposure in like two different hospitals, so one of which was a bit more advanced with the like x-rays and machines and investigations you could do. But on the whole, patients would come up and sit and wait hours and see like the doctors whenever they were ready. So I was able to shadow and kind of run like parallel clinic alongside some of the doctors or nurse practitioners whilst I was there. And I really enjoyed that, seeing such a range of things, seeing some much more like late stage things than you would see in the UK. In Eswatini, there are really, really high HIV rates. It's like got the highest HIV rates in the world. And you also see like malaria and dengue and tropical things that we wouldn't really see so much in the UK, but also people coming in with much later stages of like kidney problems and like lung infections. And so it was definitely eye-opening to see what why patients would come in and at what stage. And for a lot of people there was a money value as well with when they decided to come in, based on like when they had enough money to come to the hospital. So that was kind of one branch of the kind of things that I did. But I would say most of my time was spent at this little clinic that is about a 20-minute drive from the hospital, but quite a long walk if you were to walk it. And so it was a clinic called the Ebenezer Clinic. It's a nurse-led facility, which people would come in to have like their antenatal, postnatal checks. Sometimes there will be vaccinations happening, but generally this was like people's first port of call if they had something wrong with them. So often I was with some of the other girls that I was on elective with. We would come and run a parallel clinic to the nurses that were happening next door. So by that I meant that we had supervision based, because we had like the nurses would check on us and we would run things by them based on like if we weren't really sure what to do. The main thing that I found like really interesting is as soon as you put a stethoscope around your neck, we were considered doctors, and we had to kind of explain like we're not doctors, we're only like medical students, we've not yet graduated. So at times it was difficult to enforce just to like know where your boundaries were, because there were things that we weren't comfortable doing because we hadn't had the training to do it. So just like a top tip is it's really important to practice within your level of competency wherever you are in the world, regardless of what others are saying. And it can be awkward to say, actually, I don't know how to do that. I can't, or I don't know, I don't feel comfortable doing that, when there's kind of limited resources around you. But yeah, there was a real range of things. One of the standout things was I saw loads of scabies, and I've never seen scabies in the UK, and there must have been an outbreak in a nearby village. But we had so many people come in, so much that we ran out of medication that we could give. The clinic has a small on-site pharmacy, and you can see there's a picture of me in the top left with all the medications that they have. And whilst I was there, I wrote out a list of the medications that there were in the pharmacy. interesting that there's a section on kind of helminth infections and antifungals, and antibiotics were quite high, but we were limited with what you could actually do based on what medications we had, and I was very much challenged to draw on histories and examinations as being key tools in the consultation period, because you couldn't rely on sending off bloods. If you said to a patient you need to go get bloods, there's no guarantee that they're going to go, because it comes at cost to them. So that was like really interesting, challenging for me, like to improve my medical knowledge, which I think was a useful thing to have done, but it was quite nice. Like, I've just started clinical medicine again this year, to be able to have more, yeah, like you can send people for bloods and actually get x-rays done and things, whereas that definitely was not really an option at the clinic. Yeah, so that was where I spent most of my time on my elective. But I did also get a really cool experience with Mercy Air. So I would definitely recommend the elective that I went on. It's changed names now to Medical Missions Eswatini, but the main doctor who was my supervisor whilst I was there, he is an ophthalmologist and gets and has partnerships with other charities to do cool things. And one of them is Mercy Air, in which we got on a helicopter ride to a community that isn't really very accessible by roads, to deliver eye screening, dental care. They go and do other things as well, but whilst I was there, it was mainly like checking if people needed like reading glasses, and pulling out teeth was what one of the dentists did spend his days doing. So that was very cool. I've never been in a helicopter before. I don't know if I'll ever go on one again. But it was really incredible how medicine can touch the lives of so many people, and especially those that don't have it at their doorstep. So the joy that people got from putting on a pair of reading glasses that you can buy for like £1 over here, but being given them when then they could finally like see in their Bible clearly, like that was a really cool thing to experience. And then I did also spend the day with a palliative care team that get in the Jeep and go on these really, really bumpy roads for like 2 hours to get to families, to do like bereavement counselling, pain relief. Those are the main two things that they did, but it was great fun sitting in the back of the Jeep with all of the nurses, embarking on some of these adventures, and seeing not just how medicine can be delivered, but opening my eyes to how people live, and yeah, some of the like mud huts and things, which I think made me definitely realize some of the privilege that I have in the UK, and that we live in houses here that have, you know, we don't have to worry about rain coming through the roofs on the whole. But yeah. So one of the things I really appreciated about my elective was how organised it was. So I contacted Dr. Pons, who is the ophthalmologist who kind of oversees and runs the elective programme, and his wife runs, and they own a farm that is very near to the hospital, and which has like guest house facilities, such as like a little backpackers hostel type thing. So that was where I stayed. So you can see on the right, there's the building, and then I had a nice little twin room, all to myself, shared kitchen, shared bathroom facilities. And yeah, on the left, there's like a farm cafe, which had the most amazing coffee, where they'd grow the beans on site, and they had like on Friday nights we had it was called Friday Friday, so a bit like a barbecue where everyone on the farm would get together and have a barbecue. And on Friday mornings as well, there was like porridge at the Green Shed, the cafe, so everyone would have breakfast together before they head off for the day. So there was some really nice things of community, and it gave me a bit of an insight into what it would be like as like a medical missionary in Eswatini, because that's where a lot of the people that were missionaries at the hospital, that's where they lived, and kind of a bit of an insight to their day-to-day life. So yeah, there was really good community there. Wednesday night was also spaghetti and Bible study night. Not everyone was Christian who is on elective here, but I think it was definitely a good opportunity for my faith as well to grow in that and kind of investigate like God's calling for my personal life into like mission as a future doctor. So yeah. The farm also had some pretty cool activities. So we went horse riding one weekend. There's this like amazing rock that you can go to, and the sunsets were just like unreal. And yeah, it seems like I feel very nostalgic now, like thinking that this was over a year ago for me. But I really enjoyed my time. The farm's called Mabuda Farm, where we stayed. Based on where Eswatini is, we were also able to do some travel at weekends, loads of safaris. We headed to South Africa, to like the coastline one weekend. And I even ended up doing like a random trail run with other expats, and won a tree for coming in second place. So there's now a tree planted at Mabuda Farm, which is my tree. So if you end up going, you've got to let me know if the tree's still there. But it was a really good opportunity to travel as well, and yeah, see some amazing wildlife. I'd never been to like anywhere in Africa before, so I was just a bit amazed at everything with all of the safaris and things. And after my elective, my 4 weeks, I also managed to drag my sister out, and we travelled around South Africa, did a bit of a road trip. So it's Eswatini is not very far from Kruger National Park, so we spent a few days there, seeing some of the big five, and then explored a bit of like the kind of the Cape Peninsula, which was really, really an amazing experience. So that's a little bit about kind of my travels and my time. But I thought I'd give you some top tips on like what I would do if I were packing again for my elective, and what things are like really useful for me. So 100% like take a notebook. I am not normally someone who like journals, but I found it a really good outlet for me to write and process some of the difficult things that I saw whilst I was there. One thing that stands out to me was when we actually ran out of oxygen in the like medical ward at the hospital, and you just don't imagine of running out of oxygen like in the UK. Like all the oxygen was needed in all the oxygen tanks were needed in the surgical theatres. But I found it really difficult, and I actually had to like leave that afternoon and was able to just journal and process things. And my supervisor was great, so I was able to debrief with him. We had weekly debriefs into our like elective timetable, which was really useful for just more of that reflection. And I know that medical schools bang on about reflection, and like I hate having to write reflections in my portfolio and things, but it honestly was like such a useful way to process things. So definitely like take a notebook out there. The great thing now is like my journal is a bit of a memento of everything that I did whilst I was there, so it's a great memory for later on. Stethoscope. I'm sure most people in medical school have their own stethoscope, but definitely like take it with you. A lot of the quality of some like the stethoscopes that we could have used were great, and you're then taking away from like someone else being able to use that if you're needing to use it. So if you have one, definitely take one. Think about if you have, the finances of potentially leaving like a Littmann stethoscope there. It might be useful for whatever you end up. A BNF is really handy to have. You can have a paper one, and we have like a link of there's a doctor who's willing to like send you, or pharmacist, or someone who's willing to send you a BNF that you can take out with you and leave when you're there. With you there. I didn't take a paper one, but I had it on my phone, and I think I used it daily because, especially with I showed you the list of medications that we had. A lot of them were like, I don't know, third line hypertension medication I didn't know the doses of, and so being able to have somewhere where you can yourself reliably look and check things was really helpful. And kind of for a similar reason, take Oxford Handbook of Clinical Medicine. It was really helpful to just refresh myself of things, especially the tropical medicine section, which had a few bits and bobs in that I have never really looked at in detail. And when I was in some of the outpatient clinics, like with the nurses, she would really like looking through it with me. And so it's great if you can take one and leave it behind, because you never know the value that some of these resources have for other people. And you can buy them if you don't have one, like you can get them pretty cheap on like eBay and things, or even like sometimes when you get MDU memberships and stuff, you get free bits and bobs like that. So think about taking one of them with you. When I was out there, I bought some stickers because it's surprising the number of children that you see, even if you aren't headed into like a pediatric specialty. But it was really nice to be able to give something like small to children when they did come in. And so yeah, they take up no space in your suitcase. Definitely take some stickers with you. Ask where you're going if there's anything that ask the location, the hospital that you're going to, if there's anything that they want you to bring out. The clinic I was at didn't have any pulse oximeters, and had I known that before, I would have picked some up and taken them out. You can get them pretty cheap, and so that would be something I'd recommend. Contact the place and see if there's anything that they would like you to bring. But I mean, even if they didn't ask me to take a pulse oximeter, I would probably take one nowadays, because they take up no space, and it means you've got that to hand. You don't need to physically take a dictionary, but I think it's really important to learn a bit of the language. Although the main language, like the main written language, is English. In Eswatini, they speak Eswatini, and so I tried to learn a few phrases whilst I was there. I think especially coming from like, it was important for me, like with my positionality as like a white Western female student, to try and make sure that I was trying to learn the language and making an effort. I think that was definitely appreciated by like doctors and also patients alike. And definitely, where take your Bible. I found it a really important time for my faith journey. And whilst I was in Eswatini, I worked through the Travelling Light resource, which is a CMF, a daily devotional thing, where it's aimed at students that are, or it's aimed at people that are like on elective or doing mission overseas. And so it was really relevant to like what I was physically doing. And even if you don't buy the little book, which is only a few pounds, you can still access the devotionals online, so I recommend that. So that's basically my elective experience and a few tips. I did write quite a detailed report, which is on the CMF website, and there, if you still have a nucleus from I think like not the last one but the one before last, there's a mini article in there as well about my experience. So
yeah. So we've got a couple of questions from Slido, if that's okay, Ellie.
Yeah.
So I think you said you started planning sort of 18 months in advance. There was a question about when you recommend you should start planning. Was 18 months about right, do you think?
So I think I was in a slightly different position whereby I was the first year that elective started again after COVID, or at least at my university, there was that. I do definitely think it's worth thinking about your elective kind of 18 months in advance. Some of the more popular electives fill up, and you don't want to miss out on your dream place because you've contacted them too late. I do also think that if you're currently planning an elective for June time, like don't worry if you're only sending off your starter emails now, but with anything like the earlier you can start planning, the better. It also shows that you're keen for the placement and starts you off on a good foot. So I would recommend 12 months to 18 months in advance, definitely be starting to think about your elective, what you want from it, and what you want from it will direct the places that you end up finding and contacting.
Great. So how did you particularly find that hospital? Were you looking in general, or did you know about that hospital particularly?
So the CMF have a electives database, which has loads of hospitals on there, and that was my first port of call because I knew I wanted to go to a Christian hospital. So I kind of looked through that and found one that fit the kind of thing I was after. Some of them have minimum requirements for how long you stay, some have language requirements, some have like faith requirements as well. So I had to look through that, read the reports on the CMF website from people that had previously been, even though it had been like, it was quite a few years in the past, it still gives you some sort of a picture as to what the situation's like. And then there's also another website which has just slipped from my mind. I'll check what it is, but there's another like non-Christian website which has loads of electives on. I think it might be called like the Electives Network or something like that. And my hospital was also on there under one of their like faith hospitals. So there were quite a few places I looked for things, but a lot of what I ended up searching for led me to the Good Shepherd Hospital, partially because I knew there'd be other students there, going as someone traveling by myself and going on elective by myself. It seemed well organized, it was clear where accommodation was. The Ponses who kind of oversee the electives, they also have a car that we rented from them for the duration we were there, which meant we could get to and from the hospital. Everything just fitted into place. So
yeah, I guess following on from that, knowing some things, that there was a question about, did you know whether there were other students at the hospital before you came?
Yeah, so I'd asked about that, so that I knew that. And I think if you are traveling by yourself, or going on elective by yourself, it's a reasonable question to ask. And I think I would have found it quite much more challenging if there wasn't someone or people that I could daily chat to. And it was really nice. They just took me under their wing for the entire time, basically. So ask about that if that is something that you're like worried about. Yeah.
Great. There was a question about how much things cost, what things did you pay for, and that kind of thing.
Yeah, so how much did things cost? I am also speaking a year out, and cost of living probably has hit. But like I know that my flights and accommodation, whilst I was there, and like elective fees all came to about, I think, £1,000. And then whilst I was there, it was food, and you'd have had to pay food in the UK as well. Embarking on like some of the adventures we had, like going on safari, was ridiculously cheap, like the equivalent of £15, and like that's crazy. So I think things have changed, but like the elective fees themselves were about £150 so that's not ridiculous. A lot of places do charge you quite a lot to go on elective there. So yeah, sorry, I can't help more. I do have a
No,
spreadsheet
that's
with all
good.
my finances, so if anyone does want to know more the nitty-gritty, you can send me an email and I can share some of that with you.
No, that's great. It does vary from place to place, and obviously like how long you're going and all that kind of stuff, but that's really helpful guide. And so our last question for you is how did you avoid malaria? What was your strategy for that?
So part of before I went on elective was I had to have a appointment with the tropical medicine travel clinic at the local hospital to me. And so I was on anti-malarials whilst I was there, and taking precautions like if there was a mosquito net, like sleep under it when you're at a hostel or whatever, using bug spray. But yeah, importantly, wherever you go, make sure you've had the relevant vaccines. If you need anti-malarials, you're on anti-malarials. I'm sure that because you go on elective like through your university, you'll have to fill out risk assessments and sort out that kind of side of things. So yeah, do whatever you say on your risk assessment. Yeah, but anti-malarials, and that was fine.